Friends, welcome to my workplace at Ranaghat, West Bengal, India. This is a very hard cataract. In this video, we are going to see the nucleus management part of this hard cataract. By this time, the main incision and a side port on the left side of the main incision has been made. The anterior capsule has been stained with trypan blue dye and viscoelastic substance has been injected to fill up the anterior chamber. And now capsular axis is to be done. Capsular axis is being done with the help of this uterata forceps. The anterior capsule is torn and a tag is raised by the tip of the uterata. The tag is guided anti-clockwise, and in this case, to get an adequate sized axis, the capsular tag is being moved along the border of the dilated pupil. This is a mid-dilated pupil. Size of this pupil is about 5.75 or 6 millimeter. So we have got an adequate sized axis. Now hydrodissection is done. Small aliquots of BSS is injected at multiple points. The anterior surface of the lens is tapped and the lens is rotated, and it has rotated nicely. Some more visco is injected to fill up the anterior chamber, and now is the time to introduce the tip of the phaco needle. The machine being used is Ocular Cataract 3. I am going with high vacuum of 450 mm of mercury, 45 ml per minute flow rate, and 80% ultrasonic energy. And I am going to employ my technique of submarine chop. Some superficial cortical lens matter is removed, and then the handpiece is turned. The bevel is made up towards the cornea. The chopper is used to push the nucleus little down, and the tip goes into the substance of the nucleus from this equator, near the equator, to the opposite equator. Watch, it is going through the substance of the nucleus, and now I'm using my chopper to break the leathery fibers and make a nice crack. So this is a very nice crack, and this is, I can say, multi-level chopping. And now I use some more energy on the other side, rotating on 180 degree, and the nucleus divides into two heminuclei. Each heminucleus is then subdivided into two large fragments, and this is completely free fragments. And now I rotate the nucleus, come to the other heminucleus, and again in the same way go through the substance of the nucleus and divide this heminucleus into two large pieces. And now each large fragment is emulsified, and if necessary they are subdivided into smaller pieces like this. So the four large pieces can be subdivided into 8 pieces or even more if necessary. I usually tilt the nuclear pieces and start emulsifying from the apex. In that way I can make the apex blunt and I can emulsify the hard portion first. And now this is the we're going to emulsify the other heminucleus. And this is a very large fragment. Here it is. Go through it, start emulsifying, and yes, it is eaten up from one side, and now this is the smaller piece after emulsifying a portion of it. And now this is the last fragment. At this time, if there is jonular weakness, we must decrease the parameters like vacuum and flow rate, or we can use IOL scaffold technique for the last piece. But in this case there was no jonular weakness, so I'm still using the same vacuum and same power, same flow rate for emulsifying this piece. This time I'm going very slow. And this is the last portion of the last few bits of the nucleus, and it is emulsified very nicely. So we have seen the nucleus management unedited, and now after cortical cleanup the eye looks like this, and after implantation of intraocular lens the eye appears like this. Thank you very much for your attention. Hope this video will help you in developing your surgical skills. Be a great surgeon and serve your patients with love, respect, compassion and great surgical competence.